Spondylolysis, otherwise known as a stress fracture or a stress reaction or a Pars fracture or a Pars defect. What is it? It's basically a crack in the bone. So here's the human spine facing this way. Here are the bones, here are the discs in the front, here are in the back, here are the facet joints, here's the spinous process you feel when you push in your back. The stress fracture typically occurs at the Pars Interarticularis. So for every disc in the front, you have a facet joint in the back. So this facet joint, the bottom facet joints are called L5S1 because they're in between the L5 and the S1 bones. So the joint is in between, so it has two names. It has two numbers, L5S1. That's where the motion occurs. The joint above is called L4-L5 because it's in between the L4 and the L5 vertebra. So the part of bone in between the joints is called the Pars Interarticularis, which in Latin means part in between the joints. So this little bridge of bone right in the middle is the pars. And there's a black line drawn on the line over here. You can see how often we tell people about these. So a crack can happen in that bone in the Pars Interarticularis. That's why it is called a Pars fracture. Stress fractures because they're typically due to repetitive stress and loading of it. And spondylolysis in Latin literally means crack of the spine. And so all those things are interchangeable terms. What causes these? Well, they happen in 5% of the population, so 1 in 20 people get them. Most people don't even know they have them. Some people they develop before even age 6. Other people have pain for a week or two as a teenager, then the pain goes away and they forget about it. But for competitive athletes who do the same repetitive activity over and over again, it can be due to the activity. The human body is still growing, still developing, still getting strong, and this repetitive loading is too much for the bone. It causes micro cracks in the bone, and the body can't catch up and can't heal it because it never gets a rest. It keeps being traumatized every day over and over again. So hyperextension and rotation and loading one side is most predisposed to get the stress fractures. Gymnastics, weightlifting, professional football, baseball, any repetitive activity can cause these stress fractures, and the incidence can be up to 10 to 15% in certain sports. So the good news is most stress fractures heal, but they need time. The human body has to catch up, develop, get stronger, and heal this, and sometimes it takes 3 to 6 months, even up to a year. And there's no way to shorten that time frame. Bone stimulators and braces have never been shown to shorten the time the body needs to heal the fracture. It just needs time, and it needs a break. It needs you to stop loading the thing over and over again. And so our treatment program is, number one, stop the sport, stop any activity that causes pain. So a lot of times axial loading, like running, will cause the pain. Weightlifting, any rotation will cause the pain. Whatever causes the pain, the good news is it's pretty easy to know what to do. Whatever causes pain, don't do it. And let pain be your guide, and you know your pain better than anybody. So the treatment is stop the activity causing the pain for at least 6 weeks and typically 3 months. Then the second part is get your core strong. If you get the muscle strong, you can take stress off the defect and keep the stress off it and stop the fracture from recurring and being inflamed and hurting again. Our whole program is in the Back Doctor app. It's a free app in the Google Play Store and the App Store. Same program we treat professional athletes with. Takes you through quantitative program, how to get your core strong to get the stress off this stress fracture. 5 levels of back strengthening. 1 is the easiest, 5 is the hardest. As you go through the levels, it tells you when you can do certain activities if you're pain-free. So you have 2 options at this point. Number 1 is to watch the video on the Back Doctor app, the whole comprehensive non-operative program. Number 2 is, from a surgical perspective, rarely, less than 5% of the time, we will fix these surgically if they're not healing on their own. Usually we give it 6 months to a year. If it's not healing, there's 2 types of surgeries that we do. 1 is to put a screw right across the defect to stabilize it. This is done percutaneously, minimally invasive under computer navigation, 3 little stab incisions. Recovery is pretty quick. If you're interested in that surgery or the other surgery, which would potentially be a fusion, if there's a problem with the disc or a spondylolisthesis and a slippage of the bones, a fusion's a better option. We have videos on the fusion surgery. If you're interested in either one of these, please reach out. You can email us at info@watkinsspine.com. Thank you.